keep working hard, have dreams, because sometimes we feel that we will not be able to achieve it. But when you work for your dream every day, someday we know that dreams do come true. So for you also, for all the professionals or for all the students, I think this is my message, that your dreams can come true, but you have to chase them and work hard for them every day.
So, according to the World Health Organization 2021, 43 million deaths related to non-communicable disease, which is nearly 75% of all the death. NCDs are emerging as the leading silent killer globally. So, she is Akansha Tyagi. She has already worked for almost 7 years in the public health research field. So, now she is pursuing Master in Public Health at IIHMR University. Are you excited, Akansha?
I'm very excited to be here.
Okay. How is Jaipur?
Jaipur is amazing, it's beautiful. Right now the weather is so beautiful.
Hello everyone, welcome to SHETALKS. It's me Kusum KC. Today I have guest Akansha Tyagi, a public health researcher. So she has been already working for 7 years in the research field. So welcome to you, Akansha.
Thank you so much, Kusum, for inviting me and having me here. It's a pleasure to be here. I have watched all your podcasts, almost all, and they're really nice. It's very nice to know about other people, what was their journey, how they got here, like where they are in their career. It's always very inspiring and exciting to know.
Thank you so much for accepting our request. Nice to meet you.
Thank you.
Okay. In the SHETALKS program, we will be discussing more about life-related experience, unfolded story, health and well-being. So today we are focusing much more about non-communicable disease. So in the SHETALKS program, there are altogether 5 segments. We are going through the segment. So in the first segment, we will be talking more about happiness talk.
Okay, that's great.
So Akansha, you are looking always smile and happy. So may I know the secret behind your smiley face and how one can become happy like you?
Okay, so for everyone happiness has different definitions.
Yes.
But for me it's like, so I always say it's my tagline, life is beautiful.
Yes.
So by that, it doesn't mean that you don't have your lows. Every day is your high.
Yes.
So we all go through different phases in life. Some are high, some are low, but at the end of the day we have just got one life.
Yes.
And I think by being happy, so I practice Nichiren Daishin in Buddhism. So they always say that whenever you're talking about your happiness, it always depends on your environment. So
Yes.
if you try to keep other people happy, then your happiness naturally comes.
Okay.
So I always believe in like being happy and making other people happy, making my environment happy. So it just helps.
Great to know. So can you also share me one of the best moment of your life?
I think I'm very fortunate. I'm very lucky. I have many such moments. But I think one of the best moment was when I got into this MPH program, getting into one of the, most famous and biggest university for public health in like world, in John Hopkins. I think it was one of the best moment. And also I think meeting my husband. It was an amazing moment for me. Yes.
Okay, nice to know. So can you also share how you are been engaged nowadays?
Okay, so in last October 2024, so I was working in Delhi at a multi-speciality hospital, and then in October we started with our MPH program. So it is a cooperative program between Johns Hopkins Bloomberg School of Public Health and IIHMR Jaipur. So these days I am just engaged in lots of deadlines, lots of study and lots of learning. Yes.
Okay, after working almost 7 years and coming back for your study. It's a little bit challenging too.
Yes, it is. It was little challenging because it was the first time when I was living like in a different city, away from my husband, away from my parents and my in-laws. So it was challenging in that way. But otherwise, if I talk about, because as a public health researcher, when I was working also, every day we used to read something, we used to go and attend some classes, and there were like journal clubs, we used to study. So it was always a learning experience. So my touch with studying and with learning, it never, like there was no break. So I think it was easy for me to come and sit here. But I personally, like some people might say that, what is she talking about? But I love studying. I love like big lectures, like you sit in the class, you like get to learn so many things from the professors, and then you get breaks, and then you get assignments. So I love it. But deadlines also like sometimes make me feel insane.
Hectic, yes, wonderful.
Yes.
So in the second segment, we'll be talking more about real talk. We want to know more about your reality, your childhood period, mostly your childhood period, education, your hobby.
Okay, so starting with my childhood, I was born in Meerut.
Okay.
It's quite a famous place in Uttar Pradesh. And then when I was in class 4th, because my dad used to work in Greater Noida, so we shifted there. So all my childhood was in Greater Noida in Delhi NCR region. Then for my graduation, I went to University of Delhi. And then for my post-graduation, I went to Jamia Hamdard for my clinical research masters. So my childhood was, I guess, very beautiful, very nice. I have a beautiful family, touch wood. So my parents are very supportive. My grandparents, they are like the best people I can like ever have. So they are my best friends. So, and I have like beautiful and amazing siblings who always support me in every situation of my life. So I think I had a beautiful childhood. Yes.
Sounds great. So what motivated you to come back in public health research field?
Okay, that's an interesting question. So I think I entered public health. It was written in my stars, I guess. So while doing my master's in clinical research, so we have to go for 6 months to any organization to do thesis. So I came to Max Hospital, Saket. So there I met my mentor, Dr. Sujit Jha. Unfortunately, he's not with us anymore. But I think he was the one who actually taught me what actual public health is. He was the one who fueled that enthusiasm and that, excitement about working in a public health setting. So from there, my journey started, and I'm so grateful. Like I thank God every day that I have got such an amazing career, and every day I want to like get up and dive into public health. So I feel really blessed.
Okay, sad to hear about your mentor, but you come in the same field, public health, as I am also doing in the same field.
Yes.
So it is little bit much more interesting to meet with you. Do you also want to remember your other supporter friends who have motivated?
Yes. I really like this question of yours, because if like I'm just not talking about career, but in your normal life also, you can't do anything without your friends, without your family, and without the people who support you, every day. And especially in my journey, I feel the biggest motivators of my life have been my grandparents, my parents, my family, and then Dr. Jha, because with the passion he used to work in the public health field, I think whatever I've learned, I got it from him. And also my colleagues with whom I've spent these 7 years. They say that you as a person, the life you shape, or as a person how you get shaped, it's all because of the people who surround you. So I think I've been very fortunate that I've always been surrounded with passionate, enthusiastic and hardworking people who actually really want to contribute to public health.
Okay, nice to know. So in the third segment, we'll be talking more about Uncover Talk.
Okay.
So here, you have already worked for long years, almost more than half of the decade. So you have also exposure with public health related field research and other activities.
Yes.
So as being a woman, have you ever felt some of the moment which you want to share, like might be difficult or happiest things being a woman?
Okay, so I think being a woman is obviously, it's an incredible thing. Like I feel so blessed that, and especially I think living in 2025, we are so empowered and people understand who our careers, who we want to be. And I think having a great family, a great husband who always understood like what I want to achieve, and I think he's the biggest supporter.
Role of man,
yes, because so I think if we talk about like empowering females, so it comes from your home. My grandfather, like he is now 75, 76 years old, and from the background from where he came, he was always empowering. He always told me that you have to make your own way in your life. You have to, work hard, earn your degrees. You should understand the importance of education. And then my father, he was always pushing me to, work hard, and he always wanted me to go and study abroad.
Such a lucky girl.
Yes, and then I think my husband, because without him, it was impossible for me to be here. He was the one who told me that, please, you have to fill this form, please fill this application. Because I was like, I won't get into Johns Hopkins. But he had faith in me. So I think being a woman, and also it's very important for you that, because the kind of empathy we have for everyone, it's always important for you to, spread that among other people. And there were some difficult moments as well, because in a public health field, that you have to go to rural areas, you have to go in the field. Sometimes it's very challenging because people don't take you seriously. But I think I had an amazing team who, always helped me. And with this question, I also want to say that the way you communicate in public health, we always say that communication is the key. So it is very important for all public health professionals to be very empathetic whenever we are, collecting any data, or whenever we are talking to any person in the field or in the community. So it really helps you to grow as a public health professional.
Okay, great to know.
Thank
you said earlier about your co-learning with Johns Hopkins
Yes.
from School of Public Health,
Yes.
USA. So also I'm very much interested to know more about your learning experience with IIHMR and Johns Hopkins.
Johns Hopkins, okay. So you also study at IIHMR, so you know how great professors we have, the kind of facilities we get here. It's like top quality of education, and all the professors are so enriched with so much knowledge and experience. So they are able to convey whatever they have learned through the lectures. So it's very helpful for us. So also I think it's a very different, because we are in 2025. So online learning is something which we all, go through every day. So it's a different experience, but Johns Hopkins is one of the best public health institute. And I think I'm very happy that this degree has an amalgamation of both the colleges. So we are studying in an Indian setup as well as an international setup, and it actually brings us the best of qualities, the best of public health skills in us. And I'm so glad, and I thank God every day. I'm so grateful that I got into this degree.
Sounds great. So I think last month you have traveled to USA.
Yes.
So also share something about.
It was a dream to go to Johns Hopkins in person, because since October we were having our online classes, we were meeting the faculties, and we were working with other students from 40 countries on our assignments. But being there in person was something which, so I remember when we were entering into the building for the first time, I literally had tears in my eyes. I haven't told it to anyone because it was my dream to go there. And people who know me, they know like I was trying very hard. So I was actually trying to go get into PhD degree, and since like 2-3 years. But this MPH just, I never thought that I'll do an MPH, a second master's. So, but I think this was the best decision of my life, best decision, because studying in this degree has actually made me understand the technicalities of public health. So the experience and now this degree, now I think when I will go back to in the professional field, I'll be able to do much more, and I'll be able to do justice to my degree.
Congratulations and best wishes.
Thank you so much.
Okay, so you are very much interested, I think, in non-communicable disease.
Yes, because that has been my background.
Okay.
Yes.
How do you think it is leading as a like emerging public health problem globally?
Okay, so we all know that NCD, because now we have dual or triple burden of diseases.
Yes, yes.
If we talk about past, people were fighting with infectious diseases, but now because of our lifestyle, because of the choices we make every day, people are suffering from diabetes, cardiovascular diseases, hypertension, cancer, mental health.
Yes.
So I think with the growing burden, now we need to take action. Everyone, as a person, because I always say that government is doing so much for us, doctors are trying to help us, but at the end of the day, if we don't want to do something for ourselves, we won't be able to get rid of NCDs or this burden. And at the end of the day, when there is so much burden, it actually, results into so much economic burden, so much health related issues in the country. So I think we need to work on ourselves, and actually I am also working on myself, like 10,000 steps every day, which is very difficult, and making those lifestyle choices every day. So we need to be very mindful what we are eating, if we are walking or not, and how we are giving rest to our body. So everything counts.
Okay, very true. It's meaningful insight. So thank you so much. Now we'll be moving in the another segment, health talk.
Okay.
Okay, for raising the awareness on NCD, so we have set 3 multiple choice questions.
Oh, it's a quiz.
Yes, yes, quiz for raising awareness to all the general people.
Okay.
So they are very simple. So shall I start?
Yeah, please,
Okay.
please. I hope I'll be able to answer. I
Yes,
hope these are
maybe.
not tricky questions.
No, I'll give you option. Don't worry.
Okay, thank you.
So first question, what is the most common risk factor associated with hypertension?
Okay.
Option A, low calcium intake. Option B, physical inactivity. Option C, vitamin D deficiency. So, and in option D, high protein intake.
I think physical inactivity must be the one, because it is related to our everyday life. And it only not contributes to having hypertension. Like we usually say, don't eat salt so much.
Yes.
Right, because this is something which, like, in every household people say don't eat salt, you will get hypertension. But I think physical inactivity, what we are eating on a daily basis, everything accounts to
Physical
being not only being hypertensive, or I would say at the risk of getting hypertension or cardiovascular diseases or any non-communicable diseases.
Okay, very true. Yes, you are correct. So in the next question, under the WHO PIN package of essential non-communicable disease intervention. So what is the minimum recommended follow-up for a non-hypertensive patient at primary healthcare center?
Okay.
So option A, once in 2 years. Option B, once in 6 months. Option C, once in 3 months. And option D, once in 10 days.
Okay. So I would say, if so you're talking about people who are hypertensive.
Yes, WHO recommendation for a hypertensive patient for follow.
For follow-up,
Yes,
right?
follow-up.
So it must be 6 months, but I would say we should do the follow-up in 3 months if we are, because I tell my mom always, at every 3 months, mom, please just, for you to check your BP if you're hypertensive, I think daily charting is very important initially when you start with your medication. But after that, at 3 months and 6 months, it is very important. And I think I would request everyone who is watching this podcast, be it like public health professional or be it anyone, please, you should, don't think that you are too young to get hypertension or any non-communicable disease. It's the way we are living in so much stress and with such different lifestyle now, because we are sitting mostly. So everyone is at the risk of getting non-communicable diseases. So we all are responsible for our health and as well as for our parents, right? So I think through this medium, I would like to request everyone to please keep an eye on all of the risk factors which are associated with the NCDs, and these small steps will turn into a great, protection for us. So yes.
So very true. World Health Organization also recommended quarterly visit.
Quarterly visit, yes.
Okay. In the next question, last question.
Okay.
Which one of the following behavior risk factor contribute to all 4 major NCDs like diabetes, cancer, CBD, COPD? So I'll give 4 options. Option A, high salt intake.
Okay.
Option B, tobacco use. Option C, lack of vaccination. And option D, exposure to cold weather.
Oh, so the first two,
Okay.
tobacco and salt intake.
Salt intake.
These both are, I think, big risk factors,
Yes.
and with them we know that alcohol intake and intake of high, which we call HFSS, high fat,
Yes.
salt, sugar content items, the packaged item, they all increase our risk of getting
Yes.
non-communicable diseases.
Yes, thank you. For primarily, like among the four options, like primarily tobacco use.
Tobacco
and then
use,
high,
yes, yes,
Thank you so
exactly.
much for your insight.
You're welcome.
In the fifth segment, we will be talking more about Hope Talk. According to the WHO World Health Organization 2021 report, nearly 43 million people death globally every year due to non-communicable disease. So it is a huge number. It is nearly like 75% of all the death. So non-communicable diseases are leading as emerging global public health burden. So do you think it is manageable? If yes, also share something more about how we can manage it from individual, organization or systemic level.
Okay, so I think it is manageable
Okay.
because still we have time, and as our population is increasing, so the main challenge in India, like with our country, is because we are such, hugely densely populated country. So with such big population comes a lot of challenges, and we have such diverse geographic locations as well. So you know that in south people eat different food, in north people eat different food, and they have different lifestyles. So if we have a policy at a national level which which is for each and every state, it is very difficult to manage NCDs at that level. So I think having state level policies, keeping in mind the geographic location, the kind of lifestyle people have, and the kind of mindset they have for their disease, so that will be a really great solution to tackle the NCD burden in our country. And also it is just not on state or national level.
Yes.
At an individual level, it is much more important. Now in 2025, we have so many resources. We are so much flooded with knowledge, right? So as I said, at an individual level, it's our responsibility to keep ourselves healthy. And with so many resources, with so much knowledge flooded on the internet, and with access to healthcare, so it has made so much difference into our lives. If I talk about 10 years back, people were not able to go to hospitals so easily, and now you have hospitals, you have dietitians, you have amazing doctors, and you have healthcare professionals, public health professionals like us. We have so many programs running in our country. So I think participating in those programs and taking that initiative that we really want to contribute to these programs, right? So it starts at an individual level, and health obviously starts from our kitchen. So what we are eating, we need to be very mindful how much we are engaged in physical activities. If we are doing yoga, if you are doing running, everything contributes to a good health. So I think these are the measures which will help us at an individual level, at a state level or national level, to tackle the burden of NCDs.
Okay. For all the policymaker like organization or systemic, do you also want to give some suggestion?
Yes.
Or
yes.
recommendation?
A recommendation,
Yes.
of course. I wish like sometime soon I'll be able to contribute to policy making, because health is something which is not a very when we talk about health, we just talk about getting diseases, what we are eating, how much we are walking, but this is not a topic which we should talk in silos. So everything, our environment, our built environment, the place where we are living, the kind of food we are eating, the green spaces which we have, our mental health, and how we are contributing to each other's health. I think everything combined is something which contributes to our good or bad health. So our like these days we are talking about climate change. In some way or the other, it is also contributing to our health. So I think at policy level, we need to make sure that we are taking into account all these different factors and all these risk factors which are actually contributing to our health, not only our food or the physical activity, but other aspects as well. So it will help us to create much more robust policies and which are easy to implement, and people will actually get benefit from them. They are not only in textbooks or in the guidelines, they are actually being implemented at national and state level.
Okay,
Yes.
thank you so much for your wonderful suggestion and
Thank
recommendation too. So we are almost at the end of the session. So if you have any key message, all of the things, our conversation are all messages from your side.
Okay.
So if you have still remaining other something more you want to say to all the academician or any research professional, so who want to grow up in the research field, so if you have anything you can say.
Okay, so I think from our today's podcast, I have two messages.
Okay.
So one, the first message for everyone: please take care of your health, because your health should matter to you the most. In such a fast-paced lifestyle which we have these days, it is very important to take care of ourselves with so much of pollution, so much of junk food around us, and with so much of stress. So please do something for yourself every day, because this is one life and it is very beautiful and it is very precious for each one of us and for our family members. So please take care of yourself. And the second thing which I would like to say to all the budding public health professionals or who want to join public health, that this field will give you so much satisfaction when we all work for ourselves, right? But this field, even healthcare field, it is something when you work for others, for others' health. So a lot of hard work, a lot of enthusiasm, a lot of passion is needed. So whoever wants to enter the area of public health, please make sure that you are contributing at the right time, at the right level, and with all your conviction, because whatever you are doing, how much you are contributing, it actually matters to a lot of people. And when all of us will come together and work towards the health of ours and others, we will be a very good, healthy and amazing nation with lots of good things and a beautiful life which we always think we want to have. So I think this is my message, and with that I really want to say thank you, because sometimes we all read every day, but sometimes when these questions are asked, you actually think about them, like what you actually want to do or what you actually feel. So thank you so much.
Okay, thank you so much, Akansha, for your time. Even being a friend is a little bit challenging, like talking in the classroom and
Yes, outside,
and
yes.
in a podcast. It
We
is
were
little
able to
bit,
open
yes,
so
yes.
much.
Yes, thank you so much for your meaningful insight and your time. So let's bid adieu for now. So stay safe, stay healthy. Thank you.